Dear colleagues, this is a very nice and interesting case. Not so much because of the cataract, but because of the nice way that the patient tried to help me out during the surgery by moving his head a lot, and in this way make the surgery even more interesting and nice. So, using the cystotome, wash the anterior chamber from the blue, incising the anterior capsule, and this intumescent cataract, due to the fact that the patient is moving the head a lot, it's really important that I had a very fast move, especially the last part of the capsulorhexia, closing it quickly before running into the periphery. Using the chopper, I use this to do horizontal chop, but first take out some cortex material and some epinucleus from the capsulorhexis area, and then using the chopper I crack the nucleus all the way through the posterior plate, halfway through, and then rotating the nucleus 180 degrees. I use the two instruments to propagate that crack all the way and have this in this mode two separate heavy nucleuses. Now the entire nucleus is divided into two, continuing the horizontal chop, making smaller and smaller parts of the nucleus to be able to safely emulsify it. The patient is helping me also by moving the head and keeping the case interesting until the last minute. Trying to keep the bevel down and the pieces inside the bag, and do the emulsification at the iris plane. This is a shallow anterior chamber, and fairly okay nucleosclerosis. It's around 3+. It's not that hard of a nucleus. The second heminucleus is kind of a turning inside the bag, but it's not a big deal. Just holding it with the phaco probe and do more chops and make smaller and smaller pieces to aspirate will ensure a clear cornea the next day and a speedy recovery. Even this nice moving head patient, and the nice things about these cataracts is that there is not much cortex to aspirate at the end of the case. I'm taking care of the last part to slowly emulsify it and not rush through this part of the surgery. It's important to have a stable anterior chamber. The posterior capsule, it's very exposed in these cases, and Then moving the phaco probe into the cortex removal program, I clean up the last remnants of cortex inside the bag. At the end of the case, it's a clear bag. Injecting the IOL under irrigation through an AC maintainer and rotating the IOL inside the bag using the chopper, and then with the same chopper I push down the iris root to open up the angle. And that's the end of the case. Thank you for your attention.